So allow me all to introduce you to our Senator, Chris Van Hollen. He was elected to the United States Senate by the people of Maryland in November of 2016. Chris Van Hollen is committed to fighting every day to ensure that our state and our country lives up to their full promise of equal rights, equal justice, and equal opportunity. Senator Van Hollen believes that every child deserves the opportunity to pursue their dreams and benefits from a quality education, and that everyone willing to work hard should be able to find a good job. That's why his top priorities include creating more and better jobs, strengthening small business, and increasing educational and job training opportunities for individuals of all ages and in every community. Senator Van Hollen started his time in public service as a member of the Maryland State Legislature, where he became known as a tenacious advocate for everyday Marylanders and someone who's unafraid to take on powerful special interests on behalf of working people. In 2002, he was elected to represent Maryland's 8th Congressional District in the House of Representatives. He would go on to serve as a member of Democratic leadership and was elected by his colleagues to be a ranking member of the House Budget Committee and protect vital interests like Social Security and Medicaid. A tireless fighter for the people of Maryland, Chris Van Hollen has also been known for working hard to find common sense solutions to difficult national issues. In January of 2015, he released a comprehensive plan to address the problems of growing inequality in America and provide a blueprint for building an economy that works for everyone, a goal that he will continue to fight for in the U.S. Senate. Senator Van Hollen has a long history, both legislative-wise and advocacy-wise, of fighting for working people here in Maryland, and I hope you join me in welcoming our Senator Chris Van Hollen tonight to talk to us about COVID-19. Thank you, Senator, for joining us.
Well, thank you very much for that introduction. Thank you for your leadership of the Lower Shore Progressive Caucus, and thank you to all the members of the Lower Shore Progressive Caucus. We need you more than ever as we try to first, battle this pandemic, but then also win the larger fight for the future direction of our country. So we first have to defeat the coronavirus. Then we need to defeat Donald Trump. First steps first. Let me just brief you a little bit on where we are, because then I really want to get to your questions as we go forward. Obviously, our focus has been on addressing the healthcare emergency. The biggest challenge in that fight has not been money and resources, because the Congress has come together very rapidly to provide an enormous amount of resources, both for the healthcare fight against the coronavirus, but also to address the economic fallout. But the biggest issue we have now on the healthcare front are these huge shortages of necessary equipment, personal protective equipment. So healthcare workers and other first responders on the front line and keep themselves safe while they're working to save others, making sure we get testing equipment so that we can get a better handle on the virus and contain it. And we're facing dramatic shortages of those supplies in the country. Tomorrow, our federal delegation will be on the phone again with FEMA to try to break loose some of those supplies. But the real issue here is that really because of a lot of neglect from the administration, we were 8 to 10 weeks behind the curve in terms of confronting the virus and getting testing up and running. And now we face this national shortage of supply because we should have put in place the Defense Production Act a long time ago and required the greater production of supplies of critical equipment. So that is the ongoing challenge right now when it comes to fighting the coronavirus. But of course, we're also experiencing a huge economic fallout. We saw unemployment claims in Maryland double in 1 week. and we're seeing the same thing around the country. So let me just briefly sketch out the key items that are designed to help in what we call phase 3 of the bills passed by Congress. And it is unusual to see Congress move so quickly and in a bipartisan way. Rounds 1 and 2 were focused primarily on additional health resources to public health agencies and others on the front line, beginning to shore up the unemployment insurance systems around the country. Round 2 was to make sure that we have free testing because nobody should be deterred from getting a test because they can't afford it. That, of course, exposes lots of other deep divides in our healthcare system. And round 2 also included significant provisions for paid sick leave, although it did not go as far as many of us would like. But those were important provisions because we don't want people, who feel sick going to work because they need the paycheck when they should be staying home, taking care of themselves, and also preventing others from getting infected and sick. So those were rounds 1 and 2. Round 3, of course, was $2 trillion. I will say that the original proposal from the Trump administration was weighted heavily toward large businesses and bailing out industries with no strings attached. The final version is weighted predominantly toward helping workers and helping families and helping small businesses and nonprofits. It still contains a lot of low interest loans and help to bigger industries, but with much more oversight and transparency, although as you've seen, the president is still fighting against those transparency measures. I will say I wish there were more conditions applied. There were some important ones on that assistance, including not using the funds for stock buybacks or executive compensation. I would have liked to see even more, but we were successful in getting a number of really important provisions in the bill, starting with a very dramatically expanded safety net, an unemployment compensation system that will both increase the payments by $600 per week on top of what someone would normally get if they go into the unemployment system. And of course, this is people who are losing jobs through no fault of their own because of the coronavirus. You work for a restaurant, you work for retail, whatever it may be, you now can get that enhanced unemployment insurance. Plus, we dramatically expanded who's eligible for unemployment insurance beyond those who are traditionally in the system, to the self-employed, to independent contractors, to gig workers, to part-time workers. That's a very important piece of that strengthened safety net. That will last for 4 months till the end of July. It may well need to be extended. I should say the unemployment benefits themselves are extended for a much longer period of time, but not at the higher levels. So UI is a big piece of this. There's for small businesses and nonprofits, these are entities 500 people and under. There are large incentives for small businesses to retain employees on payroll, and if they already were forced to let them go, to bring them back and rehire them. That includes loans that would then be forgiven entirely for small businesses if they meet those criteria, because it doesn't do a small business a lot of good to just get more loans and have a bigger anchor around their neck at the end of a 2 or 3 month period when they started and be unable to repay those loans. So those loans are forgiven so long as they're used for the express purposes, maintaining payroll and paying fixed costs. That also applies to nonprofits of 500 and under. There are also these direct payments, and originally The Trump administration wanted people up to $1 million to qualify, which is absolutely ridiculous. This needs to be targeted mostly on people with needs. So we were able to scale that down. I can go into the details of the direct payments, but they apply to people in full amounts below $75,000 of individual income, $150,000 for a couple. And importantly, while the Republicans had it designed so that people at the lower end of the income ladder would get less, we changed that so everybody is treated equally. And so if you really had no income to speak of last year, you still qualify by filing an earned income tax credit, so that's a refundable credit. Finally, another big piece that was not in the original proposal was help for state and local governments who are obviously struggling to meet all their requirements to their citizens. I understand Jake Day may be on the line, the mayor, as well as Josh Hastings of Wicomico County Council, and to others who are in local government. The stresses that you're undergoing at this time. So we provided help to state and local governments. The state of Maryland will get $2.3 billion to help, and we're counting on the state to use that help for some of our smaller municipalities. Larger jurisdictions in Maryland, so Baltimore City and our 5 counties that have over 500,000 people will get direct assistance from the Department of Treasury. They won't have to go through the state of Maryland. We also have significant funds to help our school systems throughout the state of Maryland, and another number of other programs, CDBG grants and things like that for certain municipalities that qualify. Also, greater assistance for fire grants and firefighters and first responders. I'm not going to go on. This is a huge bill with lots of important provisions, but rather than try to walk you through all of them, why don't I open it up for questions and comments, and thank all of you for working together, not physically, but certainly in spirit, as we all observe the social distancing guidelines to try to defeat the coronavirus. And thank you for being engaged in the larger battle to move our country forward. And with that, Jared, why don't I turn it over for questions?
Yeah, so just a reminder, I'm about to unmute the first person. So if you have a question to ask, remember to directly message Karen Smith your question, and she will pass along your name, and I will unmute you, just so we can get a kind of an order going here. The first question is Miss Joan Roach. Joan, can you hear us?
Yes. I was wondering why there seems to be such resistance to allowing the senators and delegates to vote remotely, so that you can both get business done and still be safe as far as your health.
Well, that is a very good question, and as one who supports the move to allow us to vote electronically, we're trying to persuade our colleagues that makes a lot of sense at this time of emergency. I mean, you could structure it so that this kind of allowance only applied in times exactly like this, where it makes sense. So there's resistance from Mitch McConnell in the Senate. I don't know what kind of support there is overall in the House, but I can tell you in the Senate, many of us have pushed for this, certainly on an emergency basis, and McConnell has so far refused. Now, we were able, of course, to get this bill passed in the Senate, but the House members, put themselves at some risk when they were, some of them were forced to come back because you had the congressman from Kentucky refusing to allow unanimous consent. So we are continuing to pursue that. There are lots of issues regarding both voting in the Senate and the House, but also issues related to voting in Maryland and other states across the country in the upcoming election that we need to all be paying attention to. It's something that I'm focused on along with these other things. And let me take this opportunity to also thank Karen Smith for helping put together this phone call.
Yes, definitely a big round of applause to Karen, our communications co-chair. She's been fantastic work, and she deserves a big round of applause for putting this together. Next question, Senator, is from Mr. Mario Ramirez. Come on, unmute. Work with me. There we go. Can you hear me?
Yes, I can hear you.
You on? You can ask your question.
Right. So this may be just a rumor, but I heard that the Secretary of the Treasury can withdraw some of the restrictions on the buybacks for stocks and executive bonuses on the CARES bill, on the CARES Act. How are we safeguarding against that kind of stuff?
So we tried to those two provisions we tried to tie down pretty strongly, and I think successfully with respect to stock buybacks and executive compensation. So I would be very surprised if they found a way around that. But we will certainly be on the lookout for that. This is one of the reasons why it's so important to have the oversight that we mandate in the bill with the Inspector General. As you know, Trump said that he was going to be the Inspector General at one point, but we will, yeah, exactly. So we will make sure that those provisions are followed through. A lot of the protection here is with regard to having a strong, independent Inspector General who we gave subpoena power to in order to make sure the funds are used appropriately and that the public has, transparency into the funds. But we did specifically tie down the two provisions you mentioned, and if there's a way around it, I would be surprised. But let's just keep an eye on this administration.
Thank you.
Thank you, Senator. Our next question is from Mayor Jacob Day of Salisbury. Mayor Day, can you hear me?
Can you hear me?
Yes, we can. Feel free to ask.
Yes.
Senator, first of all, I want to thank you and Senator Cardin for the conversation with local elected officials earlier today, or with municipal officials earlier today. And I apologize, I didn't ask this question then.
Well, no, thank you for mentioning that. Yeah, we had a great discussion, as you know, with municipal leaders across the state. Thanks.
Well, and frankly, it's very reassuring, the access that we've had. Your team and Senator Cardin's team have both been readily accessible. And frankly, a majority of the questions that we're getting as local elected officials pertain to things that are coming out of your office. And you all are doing just a fantastic job helping. But my specific question had to do with a topic that came up, which was the Paycheck Protection Program. And while we were having that call, I had banks that were sort of frantically sending us messages. We've been pushing our small business owners, many of whom have had to lay off their employees, to look at the Paycheck Protection Program as a great mechanism to get cash, to bring people back in, to keep people employed, et cetera. And what the concern is from the SBA certified lenders is a lack of what they see as a lack of clarity from the Small Business Administration on how loans will be originated or documented, or loan authorization will be completed. And that lack of clarity just leads to a lack of speed, and everybody wants to be quick to address the economic impact and the impact on individual finances here. Can you speak to what we all might be able to do, or you might be able to do, or how we might be able to influence the SBA to produce those rules quickly, to get information to our local banks here in our communities?
Yeah, thank you, Mayor, and thanks for asking about that issue, which, look, this legislation will only be as successful as its ability to implement it quickly. And as you heard Senator Cardin and I on the phone call earlier, we are concerned with the ability for both SBA and others to quickly stand up these programs. And obviously time is of the essence. So they are supposed to be putting forward some of their early guidelines as early as tomorrow. I believe they're going to roll them out in steps. So I think the general provisions governing the Paycheck Protection Program will be out tomorrow. For sole proprietors who are also eligible, I think those will come a little later. There are significant questions about to what extent they apply to some of the on the nonprofit side that they will also be spelling out. But we are going to push them very hard. Now, I should mention one thing, which is that the Paycheck Protection Program flows primarily, it originates, of course, in the SBA, but it flows through community banks and community lenders. And there are huge incentives in this legislation for those lenders to get the money out the door. And we also dropped many of the requirements that usually apply to their making loans. So we are trying to expedite the process. I've also been on the phone with all the leaders of the Maryland Bankers Association, and I'm going to be doing another one with a much broader group to really push them to expedite this process. And they actually, built into the bill, have some interest in doing it and very little risk, because these are loans that are now guaranteed by the government, and of course ultimately will be forgiven if the businesses comply. All that said, Jake, make sure your people continue to stay in touch with our team and Senator Cardin's team. As you hear stories, we've assembled a group on our state staff, and Melissa Kelly's on this line, of course, is our great rep on the Eastern Shore. But we're put together a team to help small businesses and nonprofits with these applications when they need help. So please be in touch with us as you hear about people trying to navigate the system. There will be challenges. I mean, there are, as you can imagine, there's a huge amount of interest and appetite for this, because small businesses are hurting and nonprofits are hurting. So we're trying to rush the help. There is another program, as you heard on the earlier phone call, which is more emergency grants and loans. These do go through the Small Business Administration, and they are designed to provide $10,000 of grants to small businesses in need, and then they can also apply for a low interest loan, and they can then fold that, if they want, into the other larger program. So there are many pieces to this. There are also some significant there are important requirements people need to be aware of. So please keep us posted. That's a long answer, but this is going to be in the area of intense interest and need. And so we should keep open lines of communication.
Thank you, Mayor Day. Next on the list is Dale. I'm going to ask everyone who asks a question to try and ask it quickly because I know the senator is on a very tight time frame this evening.
Right.
Dale, can you hear us?
Yes, I can hear you.
Awesome, we can hear you.
Hi, Senator.
Hi,
my
how are
question
you?
is, I'm doing well. My question is, what is the plan for, or is there a plan for direct community outreach, educating the community about what's all entailed in this bill, what monies are available? And I say that as a small business owner, and I know quite a few business owners that are really affected by all of this, and they don't know where to go, what to do. Is there anything that's more direct than, say, contact the SBA? Will there be any kind of direct outreach?
So we're trying hard both to encourage SBA to do it and to use our own offices to the extent possible to do that. As you can imagine, as you know, it is even more difficult during this time of social distancing. When we can really only communicate like we are now by phone and over social media and over the internet. So a couple things. Both Senator Cardin and I have put lots of information on our official websites. You just got to Google, Senator Van Hollen and on my official website. Same with Cardin, same with some of the House members. Also, our teams are standing by. Melissa, are you on the line?
I certainly am.
All
I was
right.
asking for Dale's information.
Melissa, can you just give everybody your phone number?
Absolutely. I'm looking to make sure everybody's ready to write. Dale, I see you scrambling. Let me know when you're ready. It's 202-669-1052. And there are resources in your county. So a lot of webinars are going on by SBA. I can link you up with those, and then our office. And of course, the senator has a website, and we've added a page strictly for the COVID resource page. So make sure that you're checking that out as well. Dale, I'll get your contact information from Karen and get you those links, okay?
Another thing you could,
Dale, it's a good question. We're trying. So, for example, Senator Cardin and I also had a call some time ago, right about the time the bill passed, with some of the small business associations in Maryland to try to help them get the word out, and others in that community. We just had a call yesterday with the nonprofit association in Maryland. If 700 people were on the call. So we are trying to get the word out. Now, the state of Maryland, of course, is responsible also for trying to get the word out. And they, of course, not this program, when it comes to unemployment compensation, that of course goes through the state system with all these additional federal resources. But we will do our very best to try to get the word out.
Thank you. The next question is coming from Hal. Melissa, before we jump into it, I don't know if you saw, but in the chat, you can put all the information you want as well, and everyone will see it.
Absolutely. Thank you.
Hal, are you able to hear us?
I'm ready to go, and I want to thank you very much, Senator Van Hollen, for being on this call. We really appreciate it. I'm the state organizer for Our Revolution Maryland, and this is really appreciated. Let me put it that way. You mentioned that testing is free. That is very good, but treatment is not, and we are hearing of people who won't even go in for testing because they lack insurance and fear the treatment will be very expensive. Is any provision being made for the uninsured to be treated without charge? And doesn't this pandemic demonstrate just how important it really is to have and implement a true single payer Medicare for all system like Pramila Jayapal and Bernie Sanders are promoting? And thank you very much again.
Well, thank you. So thank you for the question, and a couple things. Number one, the fact that we had to fight hard in round one to make testing free, which encountered some resistance in some quarters from the Republicans, is an example of the battle that we need to wage across the board in support of universal health care, regardless of exactly how we get there. It's also exposed the fissures, other divides in the healthcare system. At the same time that you have the Trump administration trying to rip apart the Affordable Care Act, this pandemic has shown two things. One, how important the protections in the Affordable Care Act are, because a lot of people who have insurance through the Affordable Care Act would have been denied previously. In fact, the folks who are most vulnerable because they have pre-existing conditions, the most vulnerable to the coronavirus, would have been denied. They're now covered. And of course, with the Medicaid expansion, you have tens of millions of Americans who are covered who would not otherwise. It also, as you suggest, Hal, indicates how much more we have to go to plug the holes. Again, regardless of exactly what approach we take to get there, the reality is that you're going to find people who are going to come out, either be deterred from going in or go into hospitals to be treated, and because of the co-pays or co-insurance, have large bills that they just can't afford coming out. So this does underscore the need to address and make sure we have universal and really affordable health care. It's also exposed the whole issue of cost of drugs, because we've had a battle and did not totally win it yet with respect to affordability for whatever vaccine is developed to treat the coronavirus. As all of you know, the National Institutes of Health and others are working on this 24/7. We hope to have something within 12 months or 18 months. We don't know how long this coronavirus will be with us now, or to what extent it will come back on a seasonal basis. But we need to make sure that the vaccine is available to everybody for free, and certainly at a cost that doesn't deter anybody at all. And that's just an example of this vaccine. The same thing applies to drugs more broadly, prescription drugs. So this is a huge battle. It's why many of us are pushing hard for dramatic changes in financing of prescription drugs, from allowing Medicare to negotiate, to allowing reimportation of drugs where the same drug made here is sold at 10 times less in Canada or other places. And also a bill I've introduced called the We Paid Act, which makes clear that drug companies are often, as will be the case for this vaccine, take a lot of the research that's been done at the NIH with the help of billions of dollars of taxpayer money, your money and my money, take that research, turn it into a drug, and then price gouge very taxpayers who have helped finance the research to begin with. So I've introduced legislation called the We Paid Act that would create a drug price setting system at reasonable prices, where you have that kind of taxpayer investment up front, which represents a huge amount of the drugs that are developed these days. So sorry about the long answer, but it is a big and important question. And I do think it means all of us on the progressive side need to go on we need to go with full force in support of our ideas of universal health care.
Thank you, Senator. I know, Karen, you wanted to mention something about the questions, because we are running extremely short on time with the Senator this evening. Karen, can you hear me?
Yes, thank you so much for agreeing to speak with us. Do you have time for one more question?
Yes, in fact, I can do, I think I got till 6:45 now, I'm told. So
perfect.
Yep.
I was just going to tell everybody that I had made note of the questions and I would forward them to Melissa, but perfect. Marie Vallone should next then, please, Jared.
Okay, awesome. And if you do have a question tonight that doesn't get answered, we will pass it along and make sure we get the answer to you as soon as possible. Again, we do thank the senator for his time. Marie, can you hear me?
Yes, I can.
Awesome, we can hear you.
Okay. My question is there any talk of increasing broadband to rural areas? Worcester County tried online courses for the children and it crashed the first day. Plus, there are kids that don't have access to internet in the rural areas. It should go under the defense budget as it's a necessary function of communication.
So I am glad you asked this question. It's one of the things I've been a broken record on throughout these negotiations and even before. You know, we were talking about how this coronavirus has exposed some of the fissures and problems with the broken healthcare system. It really exposes other great divides, including the digital divide and the homework gap. You know, long before the coronavirus struck, I introduced legislation called the Homework Gap Trust Fund to direct the FCC, the Federal Communications Commission, to use the proceeds of the sale for the spectrum of 5G to use at least $2 billion of that in a fund to address exactly what you're talking about. To make sure we build out broadband and make sure that no student is without access to the internet, because it creates, it adds to the already large inequalities in our school and education system when students can't do their homework in normal times when they don't have access to the internet. But certainly now, when we're trying to move toward more distance learning, and as schools are trying to, you know, keep in touch and working with their students. So in addition to the long-term bill, as part of this round 3 measure, I tried to get dedicated funding to close the homework gap in the near term. And so what that means would be to get computers to the households of students who don't have them, and to get the hotspot devices to homes that would benefit from the hotspot to access the internet. As we continue the effort to build out broadband. I mean, that is also an urgent thing, but will take more than a couple months. So the bottom line is, while we didn't get dedicated funding, we did get substantial resources to the state of Maryland to our school systems. And the total for the state LEAs is going to be $207 million. And of course, the Eastern Shore counties will get their share of those. And I made sure that an allowable use of those funds that will come to your school districts is to buy these hotspot devices and computers to try to address the homework gap on an urgent, immediate basis. As we continue to fight for resources to build out broadband so that, you know, small businesses and hospitals, you know, can operate, that we can have more telemedicine, and make sure that we're truly connected, both students and everybody else. So thank you for asking that question. There's also a pool of money for education that goes to the governor, and those funds can also be used to help build out broadband and deal with both the digital divide and the homework gap. So again, long answer, but there's a way to get there in both the near term and in the short term. And this bill does provide resources that can be used for that purpose.
Next we have Mr. Scott Kane. Can you hear me, sir?
Yes, I can. So thanks very much. Senator, thank you very much for everything you've done to navigate us through this crisis. It's just amazing what you're doing for everybody in the state of Maryland. So a big thank you and shout out to you for doing that. I had a follow-on question, Senator, to this question by Dale and Mayor Day regarding the PPP. We're getting a lot of questions with respect to that from small business people. And I just wanted to make you aware that they're saying that applications are supposed to be started tomorrow, April 3rd, but the banks are not really prepared to process those loans. And I'm not sure exactly why. Maybe that's something that you could look into. Some are saying they don't have the forms. Some are saying that they can't process SBA paperwork. They have to use their own, a lot of those kinds of things. So there's some sort of a disconnect. I just wanted to make you aware of that.
Well, Scott, first of all, thank you for all you do for the progressive causes on the Eastern Shore. And we are working hard to try to make this work through this system. While there's going to be a lot of overload, we're after both the SBA and the Department of Treasury to try to make sure they get the information out to the lenders and the banks as quickly as possible. I have other members of my team on this line as well, and they'll work with Melissa to try to expedite that effort. To the extent you can, and you and others on the call can keep us informed of specific examples, it allows us to go back and find out exactly where the logjam is, whether it's with the SBA and the regulations coming from federal agencies, or whether it's from the banks and lenders themselves who are having issues or misunderstandings. So to the extent that you can get specific cases to us, that allows us to help not only with those cases, but to help get the kinks out of the system. And there will be a lot of kinks in the system. There's just a lot we're trying to push through this particular pipeline.
Thank you, Senator. Being told that this was, unfortunately, we have run out of time this evening. I want to thank you on behalf of the organization for speaking to us this evening, and I hope this is not the last time that we engage with each other in a forum like this. We just want to thank you for taking the time, and also thank you for all the work you do for us in Washington, D.C. I know it's a very, let's say, hostile political climate these days down there, but we definitely thank you for being someone of good values and morals in a place that seems like it lacks it a lot of times. So thank you so much, Senator. For those of you who put questions and did not.
Let me just thank you all very much for your energy and activism, and trying to make sure that our state and the country get headed back in the right direction as we head toward November, but also helping your neighbors weather the storm. And we'll get a list of the questions that we were unable to answer and try and get answers back to you on that. And just we can do this again by social distancing, but of course I look forward to the day when we can all do this in person, and look forward to coming out to the shore at that time as well. So thank all of you very much. We're all in this together, and we will come out stronger on the other side of if we work together, and then we'll come out stronger as a country when we win the election in November. So thank you all.
Absolutely. We look forward to having you on the shore, and you have a great night and stay healthy, Senator.
You too.
So we now had a chance to hear from our senator tonight. Now we also have some members of our local elected officials who's going to kind of go over with us tonight what's going on at the county and the municipal level. So first, I would like to introduce actually the highest elected progressive candidate that we have here. Josh was an LSPC endorsed candidate in 2018 and was elected to the Wacomico County Council, excuse me. I would like to introduce our favorite councilor, Josh Hastings, to tell us what's going on here in good old Wacomico.
Thank you all. Appreciate it. First of all, thanks, Jared and Karen. Thank you for setting this up. It's great to see so many familiar faces, faces I wish I would have seen, I'd see in person sometime soon. Always great when you can have people like Senator Van Hollen and so many other folks that are here, Senator Mathias and others are having in one place. This is the most I've been dressed up for in 2 weeks, so thank you. If I could give a quick update just on what's going on with Wacomico and then our region, and then Jared, however you're going to handle after that's good. A little bit about what I know. Wacomico, we have a daily 4 o'clock conference call with emergency management, health department, a lot of elected officials, administrative leadership, and others. Just so it's said from this call, we know, in Maryland, there's 346 new cases in the last 24 hours. 81 of them are in isolation. We've had, on Wacomico, we still have 7 confirmed cases. There are 12 COVID-19 cases under investigation, 4 being treated at Peninsula Regional Medical Center. Additionally, as of this morning, Somerset County had 4 cases, Worcester had 5, Dorchester had its first case. There's a total of 58 confirmed cases on Maryland's Eastern Shore. From the call, we also learned that PRMC has also requested a module unit for beds, should house up to 10 more individuals. What the health department was basically stressing was that test kits are just not here, not enough coming, and not fast enough. I tried to get greater clarity on some of the test kits. Last week we had heard that there's going to be a drive-through site, the Shorebird Stadium, but of course getting tested is actually the biggest challenge. We've also had in the county, where we've let Mayor Day speak on this if you'd like to, but part of the conversation has included homelessness issues and a lot of folks that are now who are without shelter or coming into Salisbury. So the county executive's office is looking for ways to address that. Wacomico Recs and Parks, all of our parks have been closed until further notice. I saw a lot of folks on social media who were upset. They were the county's taking down basketball nets and tennis courts nets, and just too many people that were coming together in large numbers. And also just give an update that, obviously the coronavirus is affecting employment on the Lower Shore in Dorchester. We saw a dramatic 1 week increase, total claims of about 4,200 cases, about 2,000 unemployment cases in Wacomico alone. On a call earlier, Governor Hogan a few hours ago said that we're now entering a surge phase, as he called it, that he didn't expect to be at this phase for another 4 weeks or so. The growth rate of cases is growing about 20% a day. The governor has not proposed any kind of any limit in any travel to the Eastern Shore, but there was some Eastern Shore officials that were asking about what are ways that that we're trying to limit some of the spread across the Eastern Shore. There's not really much we can do about limiting folks coming in from Delaware, but as we know, Sussex County, as of this morning, had more than 100 positive cases, with the state of Delaware having close to 400 cases. Just some other very quick things that just so you know, also the county council, we've chosen to have our meetings via Zoom. We have our upcoming Tuesday evening meeting, 6 o'clock, and that is posted. Anyone can participate in that, and feel free to send your comments through that way. I should also mention, by the way, the other things I did want to say too. Also, I had a couple of folks who saw that I was going to be a part of this have reached out and wanted to get questions on, wanted me to ask questions, getting clarity. If we had enough space and enough beds here on the shore and the mid-shore. And part of the questions were if we were able to use Deer's Head Hospital or Poplar Hill pre-release unit space in Nanticoke, or even the Civic Center, what capacity do we have, or do we expect that we'll need that? I did get clarity to say that Deer's Head is a hospital, is a state facility, so for now it's hands off. They have been looking at the potential of the Civic Center, but of course, the issues that they've had, of course, cots. They do have cots there that they've used for shelter in the past, but not hospital grade. The county has been in touch with some local hotels and trying to get, they'd like to have more money, but they could use them to house either homeless populations or even those who are sick. But just cleaning is an issue. And then I had other questions on if the amount of cases in Delaware, how much is that affecting us? And what are we accepting any of the surging cases that are happening in Delaware? Is that coming across the border, or is that impacting us? I did get clarity that we're not, PRMC specifically is not accepting Delaware patients, but they're not going to be turned away if they, if they need to be treated. So that's just some of what we've got happening here. I'll be happy to take any other kind of questions we might have, but and I got a lot of their data, but it's a little dry.
Josh, do you mind if we do Mayor Day's update real quick and then open it up so they can ask questions to both you and Mayor Day at the same time? If you
Yeah,
don't.
please.
Okay, awesome. Mayor Day, do you mind doing a brief update? And once Mayor Day speaks, we'll open it back up to questions. It's going to be the same format as it was for Chris Van Hollen. Email Karen with your question. If you could be specific on, if you're asking a question, to say Mayor Day but not Josh Hastings, if you could be specific in that. I'm not saying Josh doesn't know about Sauls Bay. Sauls Bay based questions might be best for the mayor of Sauls Bay. So I want to welcome in the best mayor on the Eastern Shore, from the capital of the Eastern Shore, Mayor Jake Day of Sauls Bay.
Hey, everybody, can you hear me?
We can indeed.
Now, I want to give credit where credit is due. Josh Hastings is a proud City of Salisbury resident. So, he can answer questions about Salisbury too. Not only that, it was, we just learned on Facebook, thanks to, Facebook memories, it was 7 years ago today that Josh Hastings, my campaign manager, helped me get elected to office. So, owe a lot of credit to that guy. Diving into the issues at hand, I think I want to just zoom out real quick, and then we'll zoom back into the municipal and local government level. But zooming out real quick, I think people should understand that while we've had to all learn to adapt, all of us, to working remotely, not having physical access to our teams, things like that. This is a 24-hour a day operation for municipal government. I mean, we are in constant communication. Sleep is at a premium. In the early days of this, I certainly thought that I'd be catching up on emails that, sitting in the quiet office, catching up on emails. That is certainly not the case. We I think our most important role is as communicators. The offices of Senator Van Hollen and of Senator Cardin, and through Melissa and Kim, and also Ryan Snow in the governor's office, are keeping us informed of what are constant changes and constant clarifications with respect to CARES Act at the federal level, and with respect to the several and new orders and interpretations of orders that are coming out at the state level. So I think it's important to know that we're here at any time of the day to answer questions, to clarify, and then to pull that information if you're looking for it from our federal and state representatives. So I want to just a kudos to Melissa and Kim and the great job that they're doing keeping us educated. I want to go through a couple items and then I'll stop and just pause for questions. In that role, first of all, as communicators, I want everybody to know that we try to do an update daily. So at 5 o'clock every day, I do a Facebook Live update through several venues, the City of Salisbury page, my mayor's page, and my personal, to answer questions. So on a daily basis, if you're just looking for answers to, hey, how do I apply for this? What's the status on that? Can I do this? We're trying to make ourselves available, and I'll be available at 5 o'clock every day for updates. And inevitably, there's new information that comes out. The second thing I want everybody to be aware of is, as local governments, we're trying to learn from each other rather than operate in silos. So in the first week, so now almost 3 weeks ago, we stood up what we're calling the Delmarva Corona Recovery Task Force, and that group is a group of all of the municipal and county officials from the C&D Canal all the way down to the Chesapeake Bay Bridge Tunnel. So every municipality and every county is invited to participate, and we've now had 123 of the 128 local governments on the peninsula participate. The few that aren't are very, very small and have limited staff or even elected official capacity. So we're trying to share ideas. Great things are coming out of there. I mean, you'll learn something that Oxford's doing that Pocomoke can use, or that Milford is doing that Lewis can use, or only Virginia that Salisbury can use. So that's been very helpful. Additionally, oh, by the way, we broadcast that so people can see what we're talking about too. That's on Mondays at 2 o'clock. And then the Salisbury Area Coronavirus Recovery Task Force is meeting, and that's really open to the public, but it's focused on the small business and economic personal impact issues that are happening as we go through this crisis. Just trying to lean on one another, answer questions. At that time, Donna Hanlon, the superintendent, Steve Leonard, the CEO of Peninsula Regional Health Systems, and county and city officials also give an update. So we're there and ready to answer questions. That's every Tuesday at 2 o'clock. That's also broadcast. This is our third week of that call, and we're going to continue that into the coming weeks. I want to make any Salisbury area folks aware of one executive order that's gone out and the second one that's coming out. So my first one on March 22nd, really just made some management announcements, things that we're doing to try to get the senior leadership team at the city focused on the crisis and delegating some other activities. But the one that's coming out, that's likely to come out tomorrow, is getting a little pushback from some other folks in the business community locally, and one or two of Josh's colleagues. But what we're trying to do is acknowledge that not everything has been thought through at the state level or implemented at the state level that we think is really critical to protecting public health. And we can do it at a municipal level, and so we're likely to do it. And right now, the cities of Salisbury, Fruitland, and Delmar, I think, are going to proceed tomorrow morning with an announcement with respect to how many people can be in certain stores at a certain time. This will have to do with the occupancy load, so it'll shift to a temporary occupancy load in these stores. We're, of course, taking into account that we don't want to be unreasonable, but recognizing that public health must be protected, and that there are things we can do to protect public health. The city of Austin, Texas, city of Los Angeles, Alachua County in Florida, and a few other places have already implemented these standards, and they're starting to spread, and I think they're really important. So what it'll do is it breaks stores, most of which are in the city of Salisbury, but there's one or two in Fruitland that are important, and one in Delmar that are of a significant size. So over 75,000 square feet, it limits the number. Then it breaks down to 30 to 75, 15,000 to 30, 3,000 to 15, and then under 3,000 square feet, how many people can be in the store, and then sets up additional parameters for queuing outside of the store, space that has to be dictated and how it can be marked. Just trying to give some standards to these big box stores and grocery stores and food stores where people are starting to get a little agitated being on top of each other, and where there is sort of hit and miss policies being applied from the private sector. And we just want to get a standard in place. So we're working on that. We're likely to announce that early tomorrow, and just want to give everybody here a heads up that that's coming. There's a whole bunch of other things in there in that second executive order, one of which is with respect to food trucks and the queuing around food trucks, one of which is respect to the question of free samples at farmers markets and farmers markets in general. We're trying to put a stop to the free sampling. And then, you know, a couple of other things that we're just trying to do to address the things that are open. And yes, you know, we know there are essential activities that are functioning. I did want to just piggyback on some of Josh's concerns, because I think they're important to note. We're hearing a lot of concerns about testing, and we share those concerns. And we feel as if, I think we all feel as if we don't have enough power to influence the provision of testing materials at the local level. Speed of distribution of PPE is also a concern. You know, we've had to adjust to getting PPE donated by local dentist offices. So we're getting PPE. We've actually got some that has just arrived in my office today, and we're going to be taking over to the hospital that local dentist offices that aren't using it because they're closed are donating. And frankly, that's nice, but it's just an unsatisfactory answer. And I think I hope you'd agree with me on that. Also getting a lot of questions about folks with that either receive disability, SSI, or Social Security, and whether or not their checks will be automatic. And we received an update last night, and the Washington Post ran a story this morning clarifying that an emergency provision's now been put in place that will ensure that those checks are automatically dispersed in whatever form you receive your SSI payments today, whether that's you know, the card or a direct deposit or check. So I will have, I'll stick around, of course, and answer any questions that you have. Oh, one last thing I do want to share. We had an update while we've been on the call. There is an arrival of a case, an active case at the at PRMC, was transported by Salisbury EMS. This is an active case. However, it probably won't count as our numbers. It's a real oddity. It's a person who came from New York City, was a positive case up there, and came to stay with family down here, which is something we obviously do not advise. People should not be traveling once they are positive. That is obviously putting a lot of people at risk, including our first responders. So we're hoping that is an anomaly that we don't see again. But there is an 8th positive case present, but that won't, I don't think, be counted in our numbers, since that's already being counted in New York City's numbers. So again, I'm happy to stick around, Jared and Karen, and answer any questions anybody's got.
Yes. First question's from Troy, who's unfortunately having video and audio trouble. He asked, and I believe you touched on this just a few minutes ago, but he asked, what is being done to protect the elderly, both in Salisbury and on the county council, in Wacomico, sorry.
Well, so I'll maybe start, but I'm going to hand it over to Josh, since the functions associated with providing services to senior citizens are state functions. So they're often dispersed at the county level, but it's a state responsibility, so it's state funded. And in many cases, It's private services, state funded through private entities like MAC Incorporated, our local area agency on aging, which unfortunately their facilities closed, and that's where a lot of people go for their services. So there's a lot of jeopardy. There's a lot of risk. That 4 o'clock call today, I know there was an update that the health department is actively working to check on, constantly check on every one of the assisted living facilities, protecting them, ensuring that there are not increases in signs and symptoms from those facilities. And the big concern there is Carroll County. I mean, if anybody's watched what's happened in the assisted living or elder care facility in Carroll County, that's the real nightmare. I mean, that because it spreads like wildfire in one of those facilities, and you have so many susceptible people getting ill. So I think the key, Jared, is that the feeding programs that older residents rely on are continuing, and that they do continue. That questions about Social Security payments are being answered rapidly, and that funding get out rapidly. And then I'll hand it over to Josh to add anything that he's got.
I think Jake, I think you said enough more than I could probably possibly say. MAC is going to continue to be closed, I think, until the end of the month. April 24th, I think, was their date. Yeah, I'm only adding on to that. It was stressed earlier in one of the other calls that obviously this is a disease that is really hard on our older populations. Out of the stats out of, but essentially out of our 36 deaths, we had 28 of them have been over the age of 60. We have a couple folks that are actually in PRMC now that are older population. So there's been a lot of focus with the county levels. I should mention, as far as food, it's not just, of course, there's been a lot of focus at the trying to feed a lot of the children that have been that you'd normally get their 2 meals a day, but I don't think there's been nearly enough attention put on our older populations, and I'm seeing a lot of the traffic back and forth in email traffic on trying to figure out how we can do a better job, and not just neighbor check-ins, but more institutional help.
Thank you, Josh. The next question comes from Melanie Kuba. I apologize if I mispronounced your last name.
No, you're good. I just wondered, are there any legal restrictions on people traveling from out of town or out of state? I know that it is discouraged. Are there any legal restrictions?
Melanie, great question. So as I've interpreted and understood the governor's orders in Delaware, Maryland, and Virginia, I do believe that traveling into Delaware technically requires a 14-day quarantine. However, the city limits of Salisbury, just speaking as a Salisbury guy for a minute, are 2 miles from the Delaware border and about 30 miles from the Virginia border. And it is highly unlikely that, given we have quite a few essential people that commute between the two, that they're going to quarantine 14 days each time. So the practical application of putting Delaware's restrictions into place, or enforcing Delaware's restrictions, I think, just thinking of our Delaware governor or our friends up in Delaware, I don't think they're going to be able to really enforce their order. So what I think is key is continuing to look at the essential functions and essential reasons for travel, and recognizing that we are a tri-state, we have not only a tri-state peninsula and region, but a tri-state MSA, a tri-state metropolitan area now, where people commute regularly across 3 state borders, or across the borders of 3 states. It's unlikely and I think a little unreasonable to think that we can enforce that effectively. So technically, at least in one direction, yes, that is prohibited, or there are significant, expectations of quarantine on the other side of it. But I don't think practically that's going to happen.
Just to add quickly, you mentioned the DMV. I know for a fact that my dad is traveling between Virginia and Maryland pretty frequently as we speak, and he hasn't seen anything like checkpoints or anything like that stopping him.
Checkpoints, that's a good point as well. MSP, Maryland State Police, put out a press release about checkpoints, noting that they weren't going to stop anyone to see if they were adhering to the law or the orders, the executive orders, which have the force of law. So rather, they were simply saying that in the course of their other activities, enforcement activities, they would make sure people were abiding by those orders. What I'd caution people is don't read that as every police agency is going to enforce it the same way, because that's MSP is interpreting the governor's orders relatively gently. And that's a signal, I think, to every other police agency that they should exercise the same level of caution in over enforcement. But I think we all have to recognize that's not necessarily how every sheriff's department or police department will. So everybody should be careful and do the best job they can adhering to the law. And remember that the orders are intended to protect public health.
Is there anything you wanted to add to that particular question, Josh?
I would say that Wayne Strasburg, our county administrator, did actually reach out to the governor's office and did try to see what kind of measures we could take to limit travel. But as the mayor says, I think that's just really hard to enforce, and this is an area where we all live and work together.
Thank you. The next question is from Joan. Joan, can you hear me?
Yes.
Awesome, we can hear you.
So actually, I put in two questions. So I'm not sure which one. The first one was, where the meetings on Mondays at 2, where are they broadcast?
So we're broadcasting those through the City of Salisbury Facebook page. So if you follow City of Salisbury, Maryland, or if you'll go follow that, we broadcast it there. And then I try to cross post it at my Mayor Jacob Day, and I think it's Mayor Jacob Day and Jacob Day pages as well. Just so people will find it wherever they happen to.
Okay, great. Thanks. And the other question was, what's being done as far as helping and protecting the homeless population?
Great question. So Councilman Hastings has been leading this conversation at the county level. So I won't say much other than to say that our city homeless staff, as people may know here, we have a Housing First program, a permanent supportive housing program in the city, and they are our 2 full-time housing and homelessness staff are out every day, walking, meeting with the homeless residents in our community, and going to the library. And out in front of the Wicomico County Public Library, they're doing a feeding. The food's being provided by one of the homeless shelters locally, Halo. So they're supplying the food, and then the food is being provided by our staff. They're also providing other things like hand sanitizer, cleaning supplies, things like that, masks. And there's a lot more to that conversation. And Josh, I'm going to let you jump in. I've got a couple more things to add, but you probably know what the status is at the county level of that conversation.
I wish I did better. We've been on it for probably 2-3 weeks now of trying to make sure that we can get clarity. We did on the call earlier today, we did have conversations. Apparently there's groups homeless within Fruitland that are making their way into Salisbury, and others. Apparently, from what we understand, is most everyone's, for whatever reason, I think it's due to services. Everyone seems to be, a lot of the other homeless populations tend to be all coming into Salisbury. So a lot of the county efforts have all been focused on how do we help the individuals who may not typically live here, or the encampments are actually, outside in Hebron or other areas. But given the services that are available and the need there, seems to be everyone's center of town.
Well, the upside of that challenge, Mr. Councilman, is that that's exactly what our homeless neighbors do today. You know, we're familiar with, I mean, where the services are, the homeless will come. And the upside of that is we don't have to search very hard to find them. And I mean, I can tell you the other night at the South End Wawa, I interacted with 3 men with whom I've had interactions over the past 2 years. You know, we all know each other. They're homeless. They've been homeless. They've been in shelters, out of shelters, received housing, fallen out of housing, things like that. And, you know, they're scared. They're scared because hygiene is just decimated when you're homeless. Yeah. And that just puts you at additional risk. So getting hygiene supplies, getting resources into their hands now is critical. So the request that's been sent to the county through Mr. Strasburg is to partner with the city on a location where we can assemble, put up a well-spaced outdoor housing effort, tents, things like that. You know, we went down the path of talking to all of the talking to the hotels. You know, the hotels are empty. So we went down the path of talking to them. And all of these COC, the experts in homelessness, said, you're making a huge mistake. You know, one, you're going to end up hurting a lot of people on the back end of this when you tell them, or when the hotel says, okay, now they got to get out. And two, just knowing, you know, that the population, the way we do, the hotel will be ruined, just trashed. A lot of damage, broken windows, the same things that we experience in the housing that we provide for our homeless neighbors. You know, the houses often get ruined, you know, windows broken out, things that you wouldn't expect, but there's a lot of mental health issues. There's a lot of other challenges that we've got to consider. So what I'd say is finding ways to keep them as safe as possible and not have to figure it out themselves, I think is one of the best roles we can play. And that, if we can centralize that, getting medical supplies, getting food supplies, things like that, water, hygiene related items, it becomes so much easier. That logistics chain becomes so much easier to manage. So I really hope we can figure that out at a county-wide level. And we're willing to do whatever we can to staff that, support it, help. And we've got a really generous offer that's come in from the Maryland Army and Air Force National Guard units with respect to helping with that stuff. So if we can take advantage of that now and be the place that says yes, I think we'll have helped our homeless population here in the next couple weeks.
Sorry, the next question is from Marie. Marie, can you hear me?
Yeah. Mayor Day, what was the group that you were talking about in the very beginning about Delmarva Recovery something? I didn't get the name of it.
The Delmarva Coronavirus Recovery Task Force. It's all of the municipalities and counties on the peninsula. So the reason the word recovery has been championed in these efforts is really to try to think not only how do we stick together through the crisis, but how do we stick together through the upswing and stay united, sharing information, sharing ideas all the way through this.
Has Berlin been involved in that at all?
Yes, ma'am. So Berlin, I think it was acting town administrator was on the call the first time. I can't remember who, but I can find out for you. But yeah, not this Monday, but last Monday they participated. They weren't on the call this Monday.
Okay, thank you.
No problem.
The next question we have is actually for me. I know you've mentioned some of the ways we could be helpful, and I know our organization, I want to thank Seamus and Karen for really leading the social media efforts and collecting information and getting it out. how can this organization and the other organizations that are represented here in this call tonight help you at the county and city level in getting information out? I know we've tried to publish your daily, your wall side chats. Need to get you a fireplace to kind of spread information, but how could we be more helpful to you?
Josh, you want to take that? You want me to take that?
I'll jump in first. And well, sorry to say, there's a lot of great organizations who, by the way, who have been stepping up. You know, in Worcester County, you have Baked, who's done a great job. The DBC, in Snow Hill, a lot of organizations like these that are trying to find out what the community needs and see how ways that they can help, especially for preparing lunches, those kind of things. There's a lot of those kind of efforts that are happening. I know we've got a couple groups in the counties that are trying to make masks. As of this afternoon, it came out, the Trump administration is going to recommend that everybody start wearing masks, much like Asia did, but however, just cloth masks. So there's a need to try to organize that. I'm personally trying to share everything that I can on my Facebook page, for my council page, anything that efforts that I know are going on that volunteers can jump into. I know, you know, with Snow Hill, they're doing 2 meals a day. They need volunteers 5 days a week. So I'm going to try to continue to share those, and if anybody, you know, could continue to share those around, that'd be helpful. And then I'll share any data. I've tried to do a good job of that. I'm trying to, anything that I hear that's happening or anything that's current information, to try to get that out to you guys.
I think that covers it really well. The last thing I'd add is that there are a couple efforts that are in need of volunteers, and anybody willing. I know the Maryland Food Bank in particular is looking for volunteers. So anybody willing to go help Maryland Food Bank, whether that's with, I think it's mostly food packaging, not distribution. So it'd be going to their facility on Owens Branch Road, I think it is. Is that right, Josh? Owens Branch? And then packaging up food for delivery or distribution, and probably for distribution to another site where it'll be further distributed. So I think that's one of the additional things that this group could do, is just, that's a hands-on way of being involved. And I'm sure there are other efforts in need of volunteers that I'm not aware of. You know, those that are essential.
I check out too, if you're not already on Delmarva coronavirus Facebook group. That's actually a pretty good group. Now has tens of thousands of individuals on it, but they've done a pretty good job of putting together any of the needs that are happening there, and trying to find folks to meet those needs.
Thank you. Yeah, any information that you guys have, if you just want to pass along to us, we'll gladly publish it and help get the word out when we see it. We'd like to be a resource to you just as much as you all are a resource to us, so we definitely appreciate it. Does anyone have any other questions for our 2 lovely speakers?
Jared, can I just say one closing thought?
Yes.
Personally, you know, that this group is willing to take the time to devote conversation to what we can all do, says a lot. So I appreciate, you know, the soul of this group and everybody who came on. You know, I also see they were probably acknowledged before we started. I jumped on a minute late, but you know, Jim Mathias and Councilperson Michelle Gregory, our future Congressperson Allison Galbraith. So just want to say thank you to them. Thank you to you for doing this. And I appreciate you all.
And amazing volunteers like Mario, who's on. Joan Roche is.
That beautiful library he's got.
Yeah. And Melissa, Kelly, thank you very much. You know, you've got a lot of great resources here, a lot of great folks. Thank you guys for making this happen. Really.
Thank you, Jared and Karen, for asking the senator to participate. I know he had enjoyed it and looks forward to making sure that everyone down on the lower shore is taken care of. So feel free to reach out. If you don't have our contact information, it's in the chat, or if you can't get to the chat for whatever reason, make sure you reach out to Jared or Karen and they'll put you in contact. Same with Kimberly Carterville from Senator Cardin's office. Either one of our offices can help your constituents maneuver through this unemployment insurance and SBA debacle. I mean, we're learning as we go. Jake, I see you smiling. I mean, it changes every hour, every minute, and we're all trying to stay on top of it as fast as we can. So have some faith. Senator Mathias, thanks for joining us. I know we've done good things down there for the HBCUs and UMES. They just got their accreditation, so kudos to them. See some friends on here. Allison, keep up the good fight. Michelle, thanks for joining us. Y'all have a good night.
Yeah, and just as we move into closing thoughts, I definitely want to thank once again Councilman Hastings, Mayor Day, Melissa, and of course Senator Van Hollen, of course the Ben Cardin staff who've joined us. They really put in a lot of work and got done a lot for the community. I know this is a very difficult time for you all as leaders, probably getting a lot of calls, probably getting a lot of texts, probably not getting too much sleep or time with family, and I know that can be very difficult. So on behalf of this organization, I would like to thank you all. Before we close tonight, I can't let the opportunity slip by to open up the floor to our endorsed congressional candidate, Allison Galbraith, if she would like to take a minute to say a word or two, and Senator Mathias of all the work he's doing down at UMES. I know he just messaged me a little bit ago about some of the things that were going on there. I don't think I could give it justice in describing. Did you want to kind of let them know about that, Senator Mathias? And then I have Allison, if you had something you wanted to say to the lovely folks of District 1, we'd love to open the floor up to you before we say goodnight.
Jim, did you want to go ahead?
Looks like ladies first.
All right. Well, I just wanted to thank you all for the endorsement. I appreciate it. Obviously, everybody's doing the best that they can, and your group is doing a lot of really good work here. Campaigning is interesting in a pandemic. And basically whatever we knew about it doesn't work anymore. So, bear with us and my staff, and try and be patient with us if you ask us for things, because we're trying to figure things out just as much as everybody else. I guess keep up the good work. Let us know if you need anything, and if I can be of any assistance. Thank you.
Thank you, Allison. Senator Mathias, are you still with us?
I am. I'm here. Thank you very much. I figured I had to unmute myself.
My bad, Senator.
I want to thank you, Jared and Karen, and all the Lower Shore Progressives for bringing us all together tonight. It's as you well know, it's an unprecedented time. But you were out there every day fighting for our democracy, and to be on point with regards to University of Maryland Eastern Shore. I just want to take a moment on behalf of Dr. Anderson to thank all of you for standing with her. We had some real challenges. We lost our physician's assistant accreditation in 2016, and that was one of her first orders of business, was to get that back. And we got a letter yesterday, as a matter of fact, announcing that we are reaccredited. We will have our first class beginning in August with 20 students. And moving forward, next year we'll be able to add 25 more, and the following year 30 more. So for a variety of reasons, being an 1890 land grant institution, making sure that we are there to provide a rural healthcare delivery opportunity, and to continue to grow that campus forward. I thank each and every one of you for the work that you do. And very simply put, both Melissa and Kim have been fabulous. From the moment I joined the university, they have been there at every beck and call, put a joint meeting together with both our U.S. senators for Dr. Anderson, and in a matter of weeks found 1890 HBCU money that we had never received before, fought hard, very hard to pass the Futures Act that back in the fall when the House moved it and the Senate wouldn't. Both of our U.S. senators stepped up to the plate, got that job done. Absolutely phenomenal. And we're all in this together. And don't think for a minute that the other side, not to become too political, isn't out there trying to figure out how to undermine us. I'm a victim. I got the tag number of the car that ran me over. I know what they look like, okay? Don't let them sneak up on you. God bless. I'm there for you and with you every day.
Thank you, Senator Mathias. And the last thing I want to say tonight, and I promise this is the last thing I'm going to say tonight, because I know this has been a longer meeting than what we're used to. Speaking in terms of campaigning for us to endorse candidates in these very interesting times. So every Saturday from 11 a.m. to 1 p.m., we are doing Zoom calls just like this, and we are doing virtual phone banks for Allison, Senator Sanders, and our other local endorsed candidates running for school board. We'd love to have you out there. The last couple of weeks, we've made a couple thousand calls into Somerset County. We're still trying to work through a list to see if we can find Karen on there. But we're also calling in Wacomico, Dorchester, Somerset, and of course Wacomico County. So we'd love to have you out there Saturday. If you're interested in any more information on it, you can see it on our Facebook, or you can just reach out to me, and I can get you everything you need. With that, I'd like to thank everyone who came out. This was our largest meeting in quite some time. We got up to about 45 people. So definitely thank everyone from the community coming in. I want to thank Ben Cardin's staff, Chris Van Hollen, and of course our local representatives, and of course our senator, still our senator in our hearts, Jim Mathias, for joining us this evening, and all the great work he's doing at UMES. So thank you all so much. If you have any questions, please feel free to reach out. And if not, you have a great night and you all stay safe and healthy. Thank you all.